It's Vaccine Day in Jamaica, exactly 1 year after the first COVID-19 case was confirmed here. Healthcare workers and senior citizens today started receiving the COVID vaccine in the fight to contain the coronavirus, which has so far claimed more than 450 lives in this country. But have the authorities been getting it right? Hello, I'm Jovan Johnson, and thank you for joining us for this special Gleaner Editors Forum, the COVID vaccine. Today, we're joined by Health and Wellness Minister Dr Christopher Tufton, Centre Nurse Kevin Morrison, broadcaster Fae Ellington, she's among the over 65 population, and entertainer Patrick Gleaner, more popularly known as Curly Lox. Ladies and gentlemen, we'll start by allowing you 2 minutes for your general comments about the COVID vaccines. Minister, let's start with you for your 2 minutes. But first, will you be taking the vaccine?
Hi, how are you? Sorry, I'm in transit from one location to the next, but good afternoon to all your guests and those online. Will I be taking the vaccine? Yes, I will be. I can't wait, actually. I am, however, sort of marshalling the troops today. We were at the Good Samaritan Inn a short while ago. Well, since early morning, where we use that facility as an important demo facility and saw a number of persons coming in, healthcare workers, but also some senior citizens, former prime ministers, former governor general, and others. My assessment of the program is that so far so good. The reports that I've had, people are coming out. We are serving the priority list, but I know we have challenges ahead, which we will have to overcome, which is vaccine hesitancy. The question is, why would people not take it? And we have to try and overcome that. And then the other challenge, of course, is to ensure that we have reliable supplies of vaccines. So I urge Jamaicans continue to observe the protocols, because that's important. We still have an issue with COVID. It's still out there. And when the vaccines are available, please take it, because it is going to be a critical part of the response to the threat.
Thank you, Dr. Tufton. Nurse Morrison, over to you. Your 2 minutes of general comments, and the same question to you. Will you be taking the COVID vaccine?
Yes, morning, everybody. Nurse Morrison here. And as it relates to the vaccine, funny enough, I'm taking the vaccine in the morning, you know. My name is already on the list, so it's a matter of time for me to get the vaccine. And I must say and encourage the other Jamaicans who are listening as well to take their vaccine. Because as it stands now, it's a matter of how we move forward. Do we just sit now and just let the numbers skyrocket while we wait until COVID decides, like, hey, I don't want to be in Jamaica anymore? So we have to do something. And as it stands, the best way forward is the vaccine. So I'm definitely taking my vaccine, and I'm encouraging my fellow Jamaicans, everybody who has the opportunity to take the vaccine, to do just so and take the vaccine.
Thank you, Nurse. Feeling your enthusiasm there. Fae Ellington, yes, you are among the vulnerable group. Your 2 minutes now, and will you be taking the vaccine?
Oh, yes. I can't wait for the Ministry of Health to advise at what date and time I should be in that line, or as I gather that you don't have to join a line. They're going to organize it in such a way that you can go at limited time and do the vaccine. But something else I want to say to you, Mr. Johnson. My mother is 93, and I spoke with her this morning, and I said, Mommy, will you be taken before it could come out? Of course! But you see, she grew up in a time when she understood the importance of vaccines. So did I, because, you know, you're born, you get your vaccine. If I didn't have on my long sleeve shirt, you see the little marks. You're going to school, you get your vaccine. You're at school, and you get your boosters. Part of what I think is happening, and Minister alluded to it just now, what is the negative thing? You know, social media is very helpful, but it can be very harmful as well. Though this country, Jamaica, has been one of those countries that has led the way, understanding the importance of giving vaccines to keep your population healthy. And I just say at the close of the 2 minutes here, had it not been for vaccines, many of us would not be around, or will be around with some serious ailments.
Thank you, Faye. We'll come back to some of what you've just talked about. We're over to you, Curly Lox. Will you be taking the COVID-19 vaccine?
I don't rule it out as yet, but right now I am in make them take it first mode.
Why?
For me personally, it's like due diligence. It's doing your own research. It's trying to find out what is objective from what is subjective truth, because the lie and the truth mix up and it's what in favor. These realities are like twins. Twin reality, because we all know how this world and business, the world of business especially, how that work. And it isn't a pretty landscape. You understand? And this is objective reality. I live in objective reality. That's where I reside, regardless of what my address is in this geography.
So you say make them take it first? Who are you referring to as them?
Make them take it first mode.
Who are you referring to as them?
I don't, the world. I mean, everybody we could see how this thing go. This is a matter of, let me tell you what really happened here, so that is not, what people don't take into consideration. Yes, there are, you don't assume that you just call people conspiracy theorists. They have been thinking, we say, all right, these credible and these credible sources and people who are saying, all right, this is, you know, you have to take the people the people who know, which is true. Word for this. But we've also seen these minds and opinions change for the worse over the years. Tuskegee experiment, a lot of there's a lot on the backside of things. And I just think we have a problem right now with reputation. If you understand me, there's a reputation problem here.
Thank you, Curly Lox. Minister, the comments there from Curly Lox point to the kind of misgivings that are perhaps among even some of the healthcare workers who are a part of the early groups of taking the vaccine. At last check, there was a significant number of people, including health personnel, who were not interested in taking the vaccine. Has there been any change? What can you tell us so far?
Well, it's early days to determine if there is any change or the extent of the change. I think we continue to monitor the environment, and we continue to approach the vaccine in a way that is focusing on vulnerables. The truth is that the most vulnerable communities are those who are most exposed in the first instance, healthcare workers. But beyond that are the over 60s. The data suggests that 80% of those who die are 60 and over with comorbidities. So we really need to get them ring-fenced by taking the vaccine, and then we move down the ladder to the younger population. We expect that there's going to be suspicion and doubt and uncertainty and outright rejection of the vaccine. It's all around us, that rhetoric or that conversation. As was said earlier, social media is very powerful, and we have a lot of young influencers in the society who either don't believe in it or maybe uncertain about it. We have a responsibility, I think, to assist with understanding, to give as much information as possible, to overcome some of those objections. You'll never get to the full target of everyone, but our target is to get to 2/3 of the population, which would give us the herd immunity so we can overcome the virus.
Nurse Morrison, how difficult is it to convince your peers to take the vaccine? And you heard Curly Lox a while ago about the concerns he has. I mean, what is it like coming from your field?
And funny enough, you know, a lot of people are similar to Mr. Curly Lox. They are on the fence, they are undecided. Because what they're saying is that this vaccine basically came out of nowhere. But what I try to tell them is that, you know, we are dealing with modern medicine. So it's not like back in the days where you know, we didn't have certain technologies to promote, you know, the development of certain vaccines. Now we have modern medicine, so things are moving a whole lot faster. But we do have the difficulties. But what I tell a lot of people, instead of listening to the general population who are saying, no, they won't take it, make an informed decision. Do some research for yourself before you make a decision. Then you can say, all right, I'm taking it because of this, and I'm not taking it because of that. Because majority of the people I know that I ask why they're not taking it, they can't give me a reason. They're just not taking it because it's a vaccine. So I mean, before you say that, just do some research, get some information, make your own decision. Don't let what the general public is saying influence your decision. Because at the end of the day, and I said it earlier, like, what are we going to do? Do we just sit and watch the numbers climb, and then we say, all right, let's hope for something? We can make a change. We can do something. Hence why I will be taking the vaccine. But as the minister said earlier as well, not the whole population then. It's 60, I don't remember the exact value, but 60+% of the population that he wants to get, the vaccine in the initial stages to develop what we call herd immunity. So in some sense then, in the initial stages, not everybody will be vaccinated. So they have time to do their research and have time to make a decision then.
Thank you, Nurse. It's interesting you say that some people claim that the vaccine has come out of nowhere, but perhaps an argument could be made that COVID-19 came out of nowhere too. Ms. Ellington, are your peers interested in the vaccine?
Most of my peers are, and those older, because I do have many older friends who are very interested. There is one person who was not sure because she has serious allergic reactions. And when we speak about allergic reactions, we're not talking about sinus issues like what I have. I'm talking about things like allergy to penicillin and that kind of thing. But I want to ask, if you will allow me, Mr. Gaynor, Patrick Gaynor, can you look on your arm and see if there are any little marks there that suggest that when you were born, you were given vaccines? And if you got those vaccines, do you know what they prevented you from getting, Mr. Gaynor? Yeah, you would have to unmute, sir. You have to unmute. You have to unmute.
Oh, cool. I'm sorry about that.
That's okay. I'm curious to hear your response. Were you vaccinated when you were born?
I'm aware. I am aware of these vaccines. But what a lot of people aren't aware of is the spiritual reality behind the physical world. Just because at certain point, because we have to understand something. Sometimes the motivation of the people in control of certain things change. And the things that we think we're still looking at have changed. And we're expecting unrealistically for it to be the same. For example, reggae. It's not what Bob Marley fought for. It's a different thing now that is influencing it, and we still have unrealistic expectation from the reputation that Bob Marley built. Edward Jenner invented the vaccine for the purpose of, like, he's a well-wisher. He had great intentions, but if it fall into different hands, he couldn't live forever. People who can possibly manipulate certain things behind the scene. Edward Jenner is dead. So the
what's your point?
Just let me finish. The people who do different things can have different intentions when certain.
And I agree with that.
So that's what the problem really is. It's not about the vaccine itself being bad. It's the people whose hands certain things fall into.
Okay, then I get you. So the point is, then you believe that the vaccine is good. It is the economics behind it that you're concerned with.
Yes, and the business, the business, the business aspect of it, and so what lens people will go to.
Yes,
so you're not making money.
But you're not going to cut off your nose to spite your face, though.
No, that is. I didn't remember when I just come out. But first, I do not rule it out.
I hear you. But me just try to convince you, become a little bit older than you. I'm missing the benefits of when we did the vaccine they were me get, and it was during all the polio time and the German measles time and all them something there. You're young but no storm. But allow us to convince you and tell you how the thing run.
But young blood understand objective reality.
Yes, and but hello, hello, Patrick. If we never objective to wouldn't they were there?
I know that
right now.
Thank you. Let me bring in Dr. Tufton here, because this is where the public education campaign becomes important, Dr. Tufton. How will it address concerns like these, such as I've raised by Mr. Gaynor?
Well, it's really about getting what the objections are and trying to understand them and reaching out using various media to get the message across, community activations, using the public health officers in the field, using key influencers as we did today with former Prime Minister Patterson and Golding taking the vaccine, former Gigi, Kenneth Hall, the nurse and others. It's a challenge because there is a counter to every argument that you advance. What is really not challengeable is the extent to which vaccines have saved lives in the world and in Jamaica. We have a very active immunization program. Our Human Development Index is based on getting that jab in your arm, with left a little scar many years back, measles, chickenpox, mumps. It's part of us. We have used it. It's backed by science and research. And we have to continue to advance that while breaking down the myths about chipping the vaccine and is a Bill Gates conspiracy theory and so on.
Mhm.
It's hard, but you know, among the younger population, like Mr. Gaynor, we have converts who believe in the process, and we will have to use them. I see Cecile, for example, a young entertainer, saying she wants to get the vaccine and she was willing to promote it on others. So it's going to be we're going to have to use all the critical stakeholders, and that's what the communications program is about.
What's the extent of the rollout with that? I see people asking for the jingles, for the influencers who are going around across the country in rural areas, among some of the more difficult to reach in terms of messaging groups. Where are things at specifically with that?
Well, we've started. I mean, there are some print ads and media ads around the vaccines. Today, with the first rollout, you'll see a lot more out there. You'll see some stuff on social media. And then at the community level, there's some activation that is now taking place. We wanted to start by getting the internal stakeholders to buy into the vaccine. Because remember now, we're targeting nurses, doctors, frontline personnel. I have personally had a lot of meetings with our nurses and doctors because surprisingly, a number of them also prefer not to take the vaccine. And that's not a good sign if you don't get the take-up at a certain level. And so a lot of effort has been done there, and it doesn't involve a lot of mainstream media. But as we now move to the rest of the population, you're going to get more of the sort of jingles and the community activation. And we'll see that over the next few weeks rolling out.
Let me bring in Fae here. Fae, you're a communication expert as well. What is critical about this campaign that has to be tackled in order to get over perhaps the concerns as have been raised by Mr. Gaynor, for example?
We have to go grassroots, and we have to, in terms of talking with the people on the ground in the communities, and we have to be careful of the language we use. I had made a post a few days ago or last week about the use of jab. That can be a very off-putting word because that is coming out of the UK and America. We don't usually speak of that. We talk about vaccination or inoculation, or some people say injection, right? Injection kind of more generic, and everything fall underneath that. But so we have to be careful that we're not turning off people maybe by the terminologies that we are using. We have to get on I see you nodding there, Patrick, and a little more I want to hear why you're not. But the jab thing is a negative thing. So we have to be careful with it. You've got to turn, because people associate jab with pain. You understand? And the vaccine really, you feel a little something, not much. You know, I was speaking to a friend of mine, Jamaica, in St. Lucia. He sent me a picture. He said he got his first shot. The other thing is, and I'm glad Minister is here, we have to, some of the older folk, like people in my mother's age group, she's 93, and they understand the importance of vaccines and the role that vaccines played. So we have to perhaps get maybe those who can move around the community still to convince some of the younger people, even they're sitting on the veranda. Well, I know my mother does that, convince people about that. But Minister, one of the questions I want to ask you, if you'll allow me, Jovan, you had said yesterday or the day before when you spoke that you're going to make sure people in the homes, you know, state homes or nursing homes, whatever, get it. What about the people in their own homes but are unable to move around? What kind of plan do you have in place to get those persons in rural communities and others vaccinated?
The public health. We have a number of ways to register persons, which includes calling a toll-free number, registering online, walk-ins, but also the public health infrastructure or public health nurses that go out into the communities who know the people who they normally go and check up on, or those who come to the health centers. We're also mobilizing through the local political structures, the parish councils, councillors in particular who know every corner of those small geographic spaces. They will assist in helping to register persons. Now, we do one of two things. You either go to those locations and administer, or you make arrangements for those persons to be transported to get the vaccine at one of the sites where the vaccine is being administered. So the intention there is to be flexible on it and respond in what is the most situationally appropriate way to ensure that the person gets the vaccine.
What's your view on the use of the word jab?
You know, I'm, I'm on two minds of it. I mean, I to the extent that it may drive fear into people, then I agree with you that you don't use it. I think the local slang has evolved over time, and people tend to shorten terminologies to represent different activities. But I do agree that vac- vaccination is probably the more traditional term. But also, when people think vaccination, they think needle. So,
But
you know, it's interesting because we were I was just talking to the president of the Nurse Association, and one of the first thing he said was, "Boy," she said, was she's afraid of the needle, and she wanted to delay a little bit because of the needle, not necessarily because of the vaccine. But anyway, she came and
The Nurses Association president?
Yeah, she came and she got it done. I mean,
doctors and nurses make the worst patients. We know that.
Yes, man, I can concur.
We're also taking questions from social media, our guests, and this is one of the questions perhaps directed at you, Minister, from Adrienne. She says, the fact that the manufacturers cannot be sued, what form of help is the Jamaican government going to offer to, say, a mother with young children to support if after taking the vaccine you develop some serious medical issues or disabilities? Minister?
First of all, let me say that the vaccines that we administer here are vaccines that have gone through significant trials and are signed off by the WHO, the World Health Organization. And so we're very confident that these vaccines are not dangerous and are very unlikely to cause any side effects that are so bad that would lead to that eventuality. However, I mean, there's always even a small risk in these things. The government is capable and has accepted responsibility for anyone who requires additional support, having taken the vaccine if they have an adverse reaction. We start with a very important counseling session at each location before it's administered. We go through the issues of if you have any allergies and several questions. People sign up and to verify their position. And then we have an observation area. Persons have to sit for 20 minutes, as Mr. Patterson and Mr. Golding did this morning. And then we give them another appointment. But they also have follow-up contact just in case something should happen. So the government is very capable, having had the experience of immunization generally, and does what it needs to do if there needs to be additional follow-up.
Thank you, Minister. We'll bring in my colleague, Damian Mitchell, at this point. Damian?
Thanks, Jovan. Minister, this question goes to you. The Finance Minister, Dr. Nigel Clark, yesterday in announcing a social program for people over 60, said that among the conditions is that they would have to present a vaccination certificate. Isn't this discriminatory, and doesn't it have the potential to be disadvantageous to people who are over 60 and are in need of the support but will not take the vaccine?
Well, persons over 60 who have a need of one form or another gets support in various ways. This is not the only window of support for the 60-year-olds and over. I mean, you know, the entire public health infrastructure, for example, is free. And so you don't pay at the point of accessing service. There are the pension benefits, the national insurance, and I could go on and on. And if you are really destitute, then there are additional benefits that you can get right up to the point of your, not just retirement, but expiration, if you will. There are funeral benefits that the Ministry of Labor offers. So I think that the program as announced by the minister is an encouragement, recognizing that the herd immunity that we seek is going to be critical to the economic recovery that we are working towards. So it does provide an incentive. Incentives can be viewed in a sense as being, in this instance, I think it's a positive motivation, not a negative motivation. What he's saying is that if you have taken on that national responsibility to go out and get vaccinated, and you have other conditions of concern in terms of you're not working and so on, then the government is recognizing your sense of collective responsibility towards the economic recovery that we see, and is prepared to give you some additional support. But it's not to say that if you don't, there's no support there for you. That would be my explanation and my understanding of what the policy.
Thanks, Minister. Jovan, if you would permit, I'd really love to hear the response of Fae Ellington to this matter.
To what was your question there?
The announcement yesterday by the finance minister.
Yeah, I agree with you. I agree with you, Damian Mitchell, that some people who do not want to take the vaccine might feel that they're being done hard by, and they're being put into a kind of a corner. And I'm not certain if they will be able to get the $10,000 in any other way, shape, or form in a timely manner or at all. So we have to be very careful. I understand why it is being done, though. It's like an added incentive, but you could in fact be disenfranchising people, or you could in fact be boxing bread out of somebody more. But I was just about to ask Jovan if I could ask Minister, how do we guarantee that there's not a shortage? So for example, you have said you expect to get X, Y, and Z, but there's a story in the Gleaner today that says that Trinidad is saying that the PAHO COVAX facility is saying that they will only get a third of what they had requested because there is a global shortage of vaccines now. What are we going to do to ensure that that does not affect us, Minister?
Well, we're pursuing a number of options for vaccines, not just the COVAX facility. We're supposed to get a small shipment next week of COVAX. But you're right, it is a problem in that what has been promised to date has not been delivered, even though there is a commitment to deliver everything, but more at the back end because of production issues globally. We're also, however, looking at facilities through CARICOM and the African platform. We're looking at some bilateral discussions with particular manufacturers. So it is our hope that we will get positive responses from some of these sources, but there is a general shortage, and there's also hoarding of the vaccines. I mean, a friend of mine called me from the US last week to tell me that they were dumping vaccines that because persons did not turn up for their appointments or for other reasons, and the vaccines having broken the seal and so on, then you couldn't store it. So it is a tragedy, as far as I'm concerned, that some countries have more than enough, and others, like Jamaica, are facing a difficulty. It's something that we have complained about in the halls of the WHO through CARICOM or otherwise. And that conversation I expect to get more intense in the weeks ahead, where the world is going to come under pressure to ensure that there's greater vaccine equity. But it's something we have seen happen with HIV drugs in the past, where the world had to come together and force drug companies to offer particular prices, because that's another issue. To the extent that you can get it, there's a lot of price increases because of the supply and demand issues. So we have some challenges ahead. That's very much the case, but we're working on it.
And Jovan, you would ask a question about communication. I wanted to have put this in. So, Minister, yes. People are saying they don't know how to register. Yes, you made the general comments about getting into some place, making a phone call, but the online registration thing, I saw a link that went around yesterday, and I utilized the link and I got through. Now, so I registered, I hope I am, for a particular regional authority, right? But there doesn't seem to be a universal rollout coming from each regional authority, so that people can go on, those who have the facility and who want to go online to make that connection, to register. What is happening with that? When will it be sorted out? And when will we know? I had to put a tweet out last night to say, okay, I will, let's check on it, because I had registered and others, somebody else, but many people are saying, we can't get through. Then a note came that the page was down. But two things, universally, when will all the regional health authorities put out something? And two, people want to know when it will officially properly start to register online.
So that initial rollout was a bit premature, to be honest. I think all those who have registered, we still have in the system. I was told there are about 3,000 or 4,000 persons, I suspect, including you, Faye, that registered. And so it will be used. It was put out by the Southeastern Regional Health Authority. All the regions are to put out at the same time, but not before another week or thereabouts, because the first vaccines to the elderly over 60 as the primary variable is likely to happen the end of March. What we're doing during the course of the next few weeks is to focus on healthcare frontline workers. That will be the Army, the JCF, and health workers, nurses, doctors, and so on. And that's the structure, the rollout structure. So it's not yet late in terms of the registration. That will roll out. We'll also advertise a number, which is being manned by a call center, as well as the public health team will go out, and some persons will be sent notices based on the database that we have to go to specific areas on a particular date and time. So you'll hear a lot more in the next week or so. And it's not late. It's just that we're dealing with the internal stakeholders now, which are a lot more manageable. Because we know where they are.
We get that, Minister, but I think the communication part of it, the efficiency of the communication. So say to people, it is not late. We haven't got it going yet. It was a little false start, or it was a test, a sample, or whatever it is. But people need to know, to be given an idea of when they'll be able to register for those who are interested, or those like Mr. Gleaner who are on the line who want to make up their mind.
Okay. All right. Take the point.
Yes. Minister, up to this point, are you aware of the number of persons who've been vaccinated so far on this first day?
Well, you have just detained me for half an hour. But it's the third of 4 that I'm going to go for the day. But where I was coming from, it seemed to have been going well. The people who had appointments were coming in. I suspect we'll have a good day in terms of the target. We expect about 3,000 plus today, because these are the enthusiasts who will come in at first. And as we go along, we'll get more, and then we have to try and convince more to come on. But so far, I am told across the country it's going well. So in another few hours, I guess I'll get an update.
Great.
I'm gonna have to go now, though. Sorry.
Yes, and just before you go, it's actually all the time we have for this special Gleaner Editors Forum. Thanks to the Health and Wellness Minister, Dr. Christopher Tufton, Center Nurse Kevin Morrison, broadcaster Fae Ellington, and entertainer Patrick Gleaner, more popularly known as Curly Lox. I'm Jovan Johnson.
Thank you.
Thanks for watching.
Okay.
Yes. Thank you, Justice.